name is Sarah Kirk. I'm a professor at Dalhousie University in Mi'kmaq in Nova Scotia, and I use she, her pronouns. I'm a member of the Capacity team, and it's my pleasure to welcome you to this webinar entitled Gathering Dust or Informing Implementation. I will just get started with a few housekeeping notices before we start the presentation, and just a few things to help the webinar run more smoothly. First, as I say, we are recording the webinar so that we can share it after the event for those who are unable to attend. I think we will have closed captions enabled for this presentation. Again, I need to check with Aman on that one. Third, if you can please mute your microphones throughout the presentation, that would be helpful. And finally, there will be opportunities to post questions in the chat box for the speaker to respond to after the presentation concludes. And I will keep an eye out for those as we're going through. Okay, so now we're going to move on to the main event, and it's my absolute pleasure to introduce you to Margaret MacDonald. And Margaret is a second-year medical student at Dalhousie University. Margaret completed an undergraduate degree in human kinetics at St. Francis Xavier University and a diploma in community health at Memorial University. Growing up in a close-knit community of Antigonish, which is also the home of Peace by Chocolate, which is a great idea for a Christmas present, Margaret volunteered for sports and activity programs for people of all ages and abilities and gained a deep appreciation of the power of community and the role of physical activity in fostering health and well-being. And in this presentation, Margaret's going to present her work from her research in medicine project, and I'm her supervisor for that. And it's exploring how a 2018 report entitled Establishing a Baseline Active Transportation AT and Health Indicators in the Halifax Region has been used. So off you go, Margaret.
Okay, just bear with me while I share my presentation here. There we go. Okay, so hello everyone, my name is Margaret MacDonald, as Sarah said, and I'm a second year medical student at Dalhousie University. I want to thank you all for taking the time to attend today. My project is entitled Gathering Dust or Informing Implementation, a case study of active transportation indicator development in the Halifax Regional Municipality. I greatly appreciate you being here, and I'm excited to share my project and its findings with you. I hope you find the presentation both informative and engaging. So here's an outline of today's presentation. First, I'll take you through an introduction to me and my involvement in the project, and then I'll give some background information, moving on to the objectives and methods of the project, and the results will be discussed in two parts. Firstly, an update to the indicators, which is the original report, which I'll discuss more in a few minutes, and then also the interviews that I did for the project. Then I'll have a discussion and concluding thoughts to end out the presentation. So first, starting out with an introduction about me. As you can see on the slides, there are a few pictures of a few of the things I've done to be active this year: skiing, hiking, and running. My core beliefs and values are that physical activity is good for health, and active transportation is just one way to include this into our everyday routines. Active transportation represents more than just a mode of travel. It's a powerful tool for fostering healthier communities and stronger, more connected communities. As a medical student and future healthcare provider, I am passionate about promoting physical activity as a cornerstone of health. Advocating for active transportation is a natural extension of this passion, as it aligns with preventative care, environmental sustainability, and equity in access to health promoting opportunities. Active transportation, or AT, refers to human-derived power to travel from one place to another, with examples of AT being public transit, walking, biking, jogging, running, and skateboarding. For most of the last 100 years, motorized vehicles have been promoted as desirable and indeed essential to complete day-to-day tasks, with little recognition of the unintended consequences of this now ubiquitous mode of transportation. The use of motorized vehicles contributes to air pollution and the risk of injury and death to road users. By contrast, AT presents little risk to others and provides benefits to health, equity, society, transportation systems, the environment, and the economy. Globally, 27.5% of adults and 81% of adolescents do not meet the recommended physical activity guidelines, and societies have become increasingly sedentary due to the use of motorized transport, along with the increased use of screens for work, recreation, and education. In 2017, more than 80% of the world's urban population was exposed to air pollution levels greater than the World Health Organization recommendations, and a key contributor to pollution is motor vehicles. Promoting AT is increasingly being recognized as a solution to the joint threats of physical inactivity and climate degradation caused by excessive reliance on fossil fuels. By choosing AT or promoting it through policy or built environment interventions, people can reduce emissions from personal vehicles, thereby improving air quality and enhancing overall health benefits. From July 1st, 2022 to July 1st of 2023, the population of Halifax, Nova Scotia, also known as Jibuktuk, meaning Great Harbor, grew by over 19,000 people, which is a record high growth rate of 4.1%. The United Nations predicts that by 2050, 68% of the global population will live in urban areas, resulting in more people being exposed to urban-specific health crises of poor air quality and physical inactivity. With Nova Scotia having one of the highest rates of chronic disease and disability in Canada, keeping Nova Scotians healthy should be a key priority for the health and other systems, such as the education, economic, and transportation systems, just to name a few. In recognition of the value of promoting AT and following the release of Halifax's Integrated Mobility Plan, which sought to increase AT rates within HRM, a report entitled Establishing a Baseline Active Transportation and Health Indicators in the Halifax Region was released in 2018. The report highlighted existing barriers and facilitators impacting physical activity and AT participation and uptake in HRM, and identified 40 AT indicators that could be used for monitoring AT-related investments in infrastructure. As well as establishing a baseline for AT, the report also aimed to increase awareness about AT and health, inform the development of policies, and identify gaps and actions for future research. The report identified a lack of information in Nova Scotia about who was using AT and why, as well as the barriers that exist to AT adoption and promotion, and the health, economic, and societal impacts of AT. Developed by an active transportation and health indicators working group with representation across health, education, municipal affairs, police, and advocacy groups, the release of the report was viewed as an important starting point for AT investments and infrastructure in line with the IMP. Implementation science is concerned with the study of methods to promote the adoption and integration of evidence-based health interventions into practice. By understanding how evidence is translated into practice, we can ensure that policies and investments made by governments and municipalities have the desired impact to improve population health, promote equity, and mitigate climate change. Thus, in this study, we sought to update the key health indicators identified in the original report and to identify if the report was being used to inform AT actions within HRM. In keeping with the principles of implementation science, our goal was to understand whether the report was informing AT promotion through semi-structured interviews with participants selected on the basis of their experiences and expertise around AT and HRM, or their participation in the creation of the original baseline report. 13 participants were purposefully recruited to participate in the study based on their involvement in AT promotion in the Halifax region or their participation in the working group members who developed the original baseline report. As previously mentioned, the results are discussed in terms of updating the indicators and through semi-structured interviews. Updated quantitative data were collected on key health indicators identified in the original report. The purpose of updating these indicators was to determine if any progress has been made in indicator monitoring since the original report was published. As mentioned, there's 40 indicators identified in the original report for continued monitoring. 28 of these indicators had baseline data, and the remaining 12 were recommended for monitoring for future work. The 5 categories of indicators are health and physical activity, transportation, investment, infrastructure, and information. Using an interview guide, participants were asked to describe their knowledge of the baseline report, their experiences with active transportation, and their thoughts on progress or roadblocks around AT promotion and HRM. A thematic analysis was used to guide the qualitative data collection and analysis in this study. Interviews were coded based on repeatedly mentioned themes, patterns, and insights of participants to develop themes for discussion. So through my search of updating the indicators, unfortunately, there was not always data available, and yet when there were data, the findings were not always promising. So, as mentioned previously, there are 5 categories: health and physical activity, transportation, investment, infrastructure, and information. I will not go through all 40 indicators today, and instead I'll just highlight some of the data that was found. So starting with health and physical activity. Some of the general trends in physical activity are that there was a decrease in overall perceived health as very good or excellent, increased rates of high blood pressure and diabetes, and a decrease in self-reported physical activity levels. For transportation, there was a decrease in personal vehicle and transit use for average commute travel times, and an increase in AT average commute travel times. There was also an increase in the number of vehicles per household for 2, 3, and 4 plus vehicle homes, but a decrease in those with no or 1 vehicle. For investment, fortunately, most of this data was hard to update and extrapolate as some of the information was from multiple reports. So some category examples included in this were the number of full-time staff dedicated to AT project planning and the number of adopted strategies or plans that link AT content to positive health outcomes. For infrastructure, there was an increase in the number of bus stops that meet Halifax's accessibility standards, and there was also an increase in the number of people using rideshare programs. And lastly, for information, again, most of this data was hard to update and extrapolate as it came from multiple reports, and an example of one of these indicators was citizen participation in and exposure to education and promotion activities. Analysis of the interviews identified 4 distinct themes: car-centric culture, idle hands and wheels, navigating the detours of AT, and every step counts. Overall, participants had shared similar opinions about the state of active transportation, the roadblocks that exist to move AT forward, the barriers for promotion and uptake, and lastly, the benefits for AT personally and for their communities. For the next few slides, I will discuss the themes with some quotes from participants, and also moving forward, just note that all participants have pseudonyms. The original report described a lack of information about who was choosing AT and why they were using it, what barriers existed, and the health, economic, and societal impacts of AT. Therefore, interview participants discussed their experiences and recommendations for AT and HRM. Throughout the interviews, it was clear that to make recommendations for future AT actions, there was a need to address existing perceptions and barriers to AT travel. Participants frequently mentioned the need for behavior change related to AT use. However, to change behavior, participants recognized the societal standards, culture, and perceptions that exist. Lizzie highlighted one of the biggest barriers as being the way people think about AT. Quote, "Sometimes I think that some of the barriers are the number of people using active transportation is less than the number of people using cars. So there is a societal framing and shift that needs to happen to move away from thinking, where do I park?" End quote. However, Alec pointed out that the pedestrians outnumbered motorists, illustrating that everyone is a pedestrian for some part of their day. In this framing, there is recognition that even the people who identify solely as car drivers also use active transportation at some point in their day. Participants also recognized that the identity people might have can be attached to their mode of travel. Participants described the societal perception collectively as the car-centric society, whereby priorities around traffic management are framed around the needs of motorists rather than people using AT. This was discussed in the context of the societal milestones of receiving a driver's license and purchasing one's first vehicle. Participants recognized that everyone, even those that identified as car drivers, needed to advocate and support AT initiatives regardless of their chosen travel mode. Recognizing that a major challenge to support AT is the car-centric culture. Quote, "I think another major challenge is the culture here is very driver-centric, and there seems to be, for many people, and I know it's not everyone's area of interest or expertise, but there seems to be a lack of imagination in what places could look like, and whilst people hold on to their car-centric view that they need to drive, and that's okay. But it's like if all the drivers were advocating for bike lanes or safe active transportation infrastructure, that there's a whole bunch of people that don't actually have to drive or would like to find another way off the road and out of traffic to make that nicer and much easier for people. So I find that challenging for people to come to terms with a different way of thinking than, just because there are bike lanes doesn't mean I have to bike, and it just makes it easy for a whole lot of other people." End quote. Supporting AT initiatives thus does not imply an obligation to use AT infrastructure, but rather empowers others to choose alternative travel modes. This shift in framing recognizes that everyone has a right to road and infrastructure use. Participants described the lack of priority from an AT perspective in terms of policies, education, and infrastructure development. Some described how AT users were often inconvenienced when traveling on sidewalks or dedicated bike lanes, describing how often bike lanes and sidewalks are blocked, inconveniencing pedestrians and cyclists and not people in cars, further prioritizing travel of vehicles more than those using AT to get around. Participants acknowledged that shifting perceptions in society is not easy, but is necessary. Throughout the interviews, it was evident participants acknowledged the importance of first identifying underlying perceptions in our car-centric culture before making recommendations for AT promotion. Conversations also highlighted the need to discuss both the progress and roadblocks to inform future recommendations. Participants were asked about the recognition of the report, any contributions they made to the report, or awareness of the report using to inform current AT actions. Although most of the participants were aware of the report and some had even contributed to it, for the most part, the participants were not using it for current AT actions. The theme, idle hands and wheels, is referring to the lack of movement in reports and implementation into the municipalities that they're supposed to impact. One participant, Delilah, summarized this by saying, quote, "I think it's tough with those reports because so much goes into it. There are such great things that come out of it, and then they kind of sit on a shelf and just kind of left behind or outdated pretty quickly, which is unfortunate," end quote. Participants identified that reports like this were necessary to establish baseline data to inform decision-making, identify health trends, and determine resource allocation. However, participants discussed the need to focus more on enacting policies and procedures and less on reporting health data, emphasizing the need for policy and action. These thoughts were recognized by most, that ultimately, the research is abundant and compelling, but the real driving force lies in action. It requires commitment from individuals, communities, policymakers, and government leaders to transform knowledge into meaningful progress. However, people felt that government leaders are not fully embracing this uptake. One participant, Alec, summarized this by saying, quote, "I understand what it's like to be inside the wire. Like you don't have perfect control, and people outside the wire sometimes tend to be very idealistic about what's possible. And there are just multiple priorities, and there's limited money, there's limited time and all, and it's a political process. The trouble is that a lot of this stuff, these decisions, all decisions are made at the top and influences at the top, and some of the more mature administrators, they don't encourage that kind of thought, or they're still looking at moving vehicles versus moving people. And so we're really seeing good initiatives by young planners. We really appreciate that. There are active transportation plans, but it just seems like we're often the poor cousin. It's sort of, okay, take care of the vehicles. And then yes, by the way, what's left over," end quote. So here, Alec focuses on the piece of standstill we often experience where no work is being done to focus on moving AT forward, and the focus is still first on vehicles. Furthermore, participants recognize that this is a multifaceted issue and responsibility should be shared at all levels, as most pointed out that commitment extends beyond the government to both individuals and their communities. Though lack of progress is often attributed to lack of commitment, it can be further exacerbated by external constraints beyond people's control. For instance, the COVID-19 pandemic also presented challenges to participants who noted that progress in AT initiatives was delayed or stalled as a consequence. This was described by participants as a loss of momentum with AT projects due to other aspects of health and healthcare delivery being prioritized and constraints posed by changes in work practices through pandemic restrictions. However, the COVID-19 pandemic presented opportunities to drastically impact AT, and yet these opportunities were not capitalized on despite the recognition of our car-centricness of our society. It shows both in the data and the day-to-day that this was not the case, where movement was stalled rather than accelerated. Throughout the interviews, participants emphasized that to make recommendations for future AT actions, it was first important to identify the next steps to encourage more AT participation. Moreover, participants identified the current modifiable roadblocks for AT and discussed recommendations for improvement. When asked about their recommendations for promoting AT, some participants reflected on the current state of AT and shared their discomfort in encouraging community members to explore AT modes. Quote, one of the things that I wrestle with sometimes and talking to other advocates, they're in the same boat, is that we don't feel good about getting too aggressive about promoting it right now because we're asking people to go out into uncomfortable and perhaps unsafe conditions. So we really feel that first, the prerequisite is, safely connected infrastructure. Once we have that mostly in place, then we can get much more ambitious in terms of our education and promotion. Participants often alluded to the difficulty of AT promotion and the context of the chicken or egg metaphor, in which to promote AT, better infrastructure is required for participants to engage, and yet people are not engaging in AT because the infrastructure is lacking. Participants discussed the importance of emphasizing safety through different strategies such as signage, decreased speed limits, speed bumps, enforcing current safety measures, for example, the 1 meter rule, and education. Participants described protected infrastructure as needing to be separated from traffic by physical barriers, such as greenery or curbs, with some emphasizing that painted lines are good in that they allocate space for cyclists, but there is nothing preventing collisions. In addition to protected infrastructure, participants discussed their frustrations about connectivity within and between communities. A lack of connectivity was viewed as a barrier for encouraging AT, as it creates difficulty for users to get from point A to point B in a safe and timely manner. Although participants had ideas and recommendations to enhance current AT infrastructure by highlighting the need for safe and connected infrastructure, some concerns were not as modifiable and focused on the barriers of AT participation in HRM. Participants emphasized the barriers to AT that discourage people from using AT modes. However, while some factors may be unmodifiable, there are still actions that can be taken to improve the situation. Participants described that the weather and geography in HRM was not ideal for all AT travel year-round. Participants commented on barriers that individuals might face due to geography of the city, stating that some daily trips for people are not feasible as the physical layout of the city is not optimal for all AT. Some participants commented on winter-specific challenges related to proper maintenance for AT, including sidewalk clearing. However, the winter season was not the only season that was discussed as impacting AT users. Construction season was referenced by participants who described their frustrations with the constant construction in and around the city being a barrier to AT use. Furthermore, without the proper infrastructure in construction zones, AT users were felt to be in more danger due to the lack of infrastructure or having to interact with motor vehicles. Despite these challenges, AT advocates work tirelessly to ensure that AT remains accessible and safe for all. For example, described by Alec, that when planners are designing a plan or proposal, the accessibility piece can be lacking in that they do not always consider plans through the perspective of people who are blind or visually impaired. Challenges in AT faced by people who are blind or visually impaired are both significant and long-standing. One participant, Carolyn, highlights one of the barriers faced by people who are blind or visually impaired. Quote, if there's not a bus shelter or you're not aware where the bus stop is, a lot of bus stops are marked inappropriately. For example, the bus stop sign will be on the telephone pole or on a tree, and as a person who is blind, you may not be able to find it at all. There's no indicator on the sidewalk or the grass line, so that's a barrier there. I know transit is working on it. There are solutions to this, end quote. Some participants commented on the nature of AT is not always the most efficient way to travel, often referencing the busy day-to-day and commitments that do not have the flexibility for AT. Participants also highlighted the importance of making AT an easier choice for people. This could include incentives for travel or an allowance for flexibility in their timelines. Moreover, prioritizing AT initiatives over motorized vehicle projects could be the first step in encouraging people to swap their car keys for a helmet. Participants recognized the benefits of AT in their everyday lives. Participants also commented on the necessity of AT for their day-to-day living. Most participants used AT for traveling to work, appointments, and task-oriented errands. Participants used a wide range of AT, with the most common being walking and cycling. When sharing their preferred mode of travel, the majority of participants commented on the benefit of connecting with community members and within the community itself. Participants reflected fondly on chance meetings with people that would never otherwise have happened if driving in a car, often describing the atmosphere as, quote, engaging, vibrant, alive, and friendly, end quote. AT fosters stronger communities by encouraging personal connections and social interactions. Further, it can benefit individuals on a personal level by offering opportunities for exercise, reducing stress, and encouraging a sense of belonging in shared spaces. Additionally, by increasing foot traffic to local businesses, AT promotes economic advantages for places that are locally owned. Participants discussed the financial benefits of AT, often commenting on the financial differences between owning a bike and owning a vehicle, adding that the expenses for repairs differ drastically. Additionally, participants recognized the added benefit of AT for the environment. Morgan emphasized that, quote, the city is a large contributor to greenhouse gases and transportation in general, so using active transportation just makes sense. We are in a climate emergency, and no one seems to be being urgent about the changes we need to make. We are still making things comfortable for people who are contributing in a large way, end quote. Participants recognized the benefits of AT for health and well-being and the importance of health and the link between health and AT. Quote, I see active transportation as a key to so many of the other mandates, which one is being health. Enabling or encouraging people to move themselves through their environments using their own power, and that's so much healthier for them, end quote. Overall, AT offers a wide range of benefits for both individuals and society, with far-reaching positive effects that extend into various areas of life. These benefits, improved health and well-being, reduced environmental impact, creating stronger communities and economic growth, both personally and for the community, creating a ripple effect that drive broader social and economic change. Thus, these areas should be key focus points for future initiatives aimed at promoting AT. This study aimed to update data on key health indicators identified in the original baseline AT indicators report and to identify if the report was being used to inform AT actions. The limited monitoring of AT indicators is telling on its own, as was the lack of availability for the 12 indicators of which data were unavailable at baseline. Findings from the participant interviews shed further light on the utility of the original report in guiding current AT actions. To our knowledge, this is the first study to assess the use of the original report and interview participants with current or past interest or roles in the promotion of AT in the Halifax region, identify progress and roadblocks of AT, and to make recommendations for future actions. Notably, the people who participated were already and continue to be involved in AT activities and therefore would be expected to be supportive of AT, and they were sampled for this reason: to have insight to talk about the report and what the current state of AT looks like. The purpose of this work was to elicit information about AT promotion, and therefore we can expect high levels of awareness and positive attitudes towards AT. This research provides insight into the progress and roadblocks in the promotion of AT in the Halifax region since the baseline indicator report was first released in 2018. While the original report was provided valuable baseline data for AT in the HRM, along with gaps in the data that could inform future indicator development, its utility is limited due to the limited dissemination and uptake. This is a persistent challenge with the translation of research into application or implementation. We found that several members of the original working group for the report had changed roles while others had moved away or no contact information could be identified. This may have contributed to a loss of institutional memory. Participants who were not involved in the report noted that they had not learned about the report from their predecessor. Detailed reports of this nature are time-consuming and expensive to produce when considering staff time for participation in multiple meetings, data trawling, and the analysis and costs associated with report production. While the report was developed with the best of intentions, the limited uptake, alongside limited progress and several roadblocks in AT infrastructure implementation, represents a knowledge to action gap. Furthermore, the development of indicators without accountability for actions to address identified areas for improvement was identified by interview participants as inadequate. This suggests that future efforts to promote AT and HRM should focus on clearly outlining the priorities, roles, and responsibilities of key partners and organizations involved, ensuring that everyone is accountable for driving progress forward. Thank you all for your attention so far. I promise to keep these final thoughts brief. Physical inactivity and climate change threaten the well-being of our communities and environment. AT has substantial benefits and promotes a healthier, more sustainable society. In this study of the progress and roadblocks to consider for future AT recommendations, participants identified a lack of uptake of current reports and procedures, challenges associated with the car center culture within city planning and processes, missed opportunities for advancing facilitators and overcoming barriers to AT, and made recommendations for future work within HRM. The business case for AT promotion is strong, yet without effective implementation, actions to promote AT remain vulnerable to cultural and political resistance, with their demonstrable outcomes at best unheeded and at worst actively undermined to the detriment of population and planetary health. Active transportation is more than just a way to get from one place to another. It's a path toward healthier individuals, stronger communities, and a more sustainable future. Municipalities play a crucial role by developing infrastructure and policies that make active transportation safe, accessible, and appealing. Expanding sidewalks, adding bike lanes, and improving public transit connections can fundamentally change how we move and live. However, it's not enough to simply implement these changes. We must also ensure they're evaluated and maintained to achieve their full potential. Moreover, safer infrastructure provides individuals the capacity to seize opportunities and integrate movement into their daily lives as they wish, whilst feeling both protected and supported. These changes can allow people to adopt habits of integrating movement into their daily lives, whether that's walking to the store, cycling to work, or opting for public transit over driving. These small, consistent choices can lead to significant collective impacts. Ultimately, active transportation is a shared effort, a collaboration between municipalities creating these supportive environments and individuals choosing to adapt their habits. Together, we can make active travel the norm, creating healthier lives, stronger communities, and a more sustainable planet. I want to thank you all for being here today. And before moving on to questions, I also want to thank my supervisor, Dr. Sarah Kirk, as my research and medicine project would not have been possible without her guidance and support. I have an extended thanks and appreciation for the Healthy Populations Institute at Dalhousie and the supportive and collegial environment provided by the HPI team. I would also like to thank Haley, Caitlin, and Chihiro for their camaraderie and collaboration throughout this study period. And of course, our research team is extremely grateful to those involved in our study. Thank you for your passion and for sharing your genuine thoughts, as this study would not have been possible without you. Thank you all again, and I can take any questions.
Thank you, Margaret. That was a really great overview of this project, and actually, it's I have another colleague that I was chatting to recently who talked about how we often admire the problem and just really don't actually take action on it. So I'm really kind of happy to have heard how this sort of worked out. And I also probably just should say I do have, well, I guess declare a conflict in the fact that I was on the original working group for the report. And those who know me do know that I have, I feel a lot of frustration for the many reports that get written that do not actually go anywhere or do anything. So I see a couple of questions. I'm going to go straight to the questions in the chat. And first of all, we have Megan Winters, who says, thanks, Margaret. I look forward to a deeper dive into this report, all with the lens of the results you've shared today. I note the report came out of the Health Authority. I wonder if and how the city was involved, and in the lack of traction action may be in part due to who has ownership of building AT infrastructure and running programs, the latter of which is usually municipalities in my experience. For example, these are indicators that seem to come from a health lens. Are there indicators the city supports or needs to report on? So I'll let you answer that and then I can chip in.
Great. Thank you for your question. Just give me a second. I'll just read it as I go. It's a loaded one. So yeah, the report was released by the Health Authority, and I think, and Sarah can correct me here, a lot of the working group members were from both like city and community. So I think more or less it was a collaborative effort. Yeah. I think it's a great point to say that, of course, maybe the ownership thing could be contributing as to why some things are taken up. As far as the indicators, There were some from the health lens, but a lot of the like infrastructure and such needed financial support, say from the city, or just support in general to move these things forward. So I would say the city also had a hold on those as well.
Yeah, absolutely. So yeah, just to give a little bit more context, so the funding was actually from the health authority, but the report and the working group was very much multidisciplinary, and you know, there were representatives from the Halifax Regional Police, for example, from the safety aspect. We had the advocate groups and also the city representation from the city on the working group, and we actually based the report itself on reports that had been published elsewhere in Canada, and I think actually Peterborough was one that was really influential in the work of putting this report together. Okay, so hopefully that answers your question, Megan. But yeah, we can certainly share more information once the final report is finished. And I see your hand, Daniel, but I'm just going to ask the question from read out the question from Becca, which says, an insightful presentation. It points to a need of accountability to be baked into these types of reports. I 100% agree. I wonder how we would be able to support that for our cities. Do you think it could be found in the way the RFPs for the report are created? That's a great question.
Yeah, thank you. The accountability piece, I definitely know Sarah and I have had lots of conversations about that for sure. I think supporting that for the cities in a way, I think goes back to part of the chicken or egg that I alluded to. So the idea that we need people to use the infrastructure that is there or active transportation to show the city that it needs to be maintained and we need more of it. But without safer infrastructure, people aren't using it. So I think it's the idea that the cities first support those who want to use AT, and then the uptake of that could improve or be better. And the RFPs, that's a proposal.
Request for proposal, yeah.
Okay, I remembered some of it. Yeah, I think perhaps the way there are submitted, it could be an accountability piece baked into those, as you said, that could help for sure.
Mm-hmm. And I mean, I would just also say, as the person, one of the people who's responsible for knowledge mobilization with the capacity project, I think again, a more developed communications plan and knowledge mobilization plan is absolutely critical. Often we do think that, you know, hey, here's this report, and I think we did try and circulate it, but often that's also a budgetary component. And if there isn't the budget, if things take longer with the main report, then often these things get, you know, they fall by the wayside. So I think it's something that certainly with the capacity that we need to really be thinking about the communications and knowledge mobilization. And indeed we are. So, okay, Dan, do you want to ask your question?
Hello, yes, I was going to ask my question. So I have a question kind of like for future Margaret. How does like medicine or like family physicians or any other kind of physician sort of contribute to this conversation? I feel like we have on the physical activity side, we have like the whole exercise as medicine kind of movement that's happening and more or less successful. And then we have this sort of urban planning, health kind of thing that obviously physicians can advocate for. So sort of how do you see your role going forward in this kind of challenging thing to advocate for?
Yeah, thank you. Good question, and a lot of what I would say I've thought about throughout the project. So I'd say from the physician perspective, and it goes for family, but for everybody, you want the best for your patients. So I think encouraging the impact that a lot of what we talk about are these social determinants of health, for example, one of which is built environment, another is our behaviors. So I think considering those and how they impact your patients, you can go down the route of exercise as medicine and that it's better and that it reduces chronic disease risk. However, there's also the side of things that a lot of what comes up in the research is these completely avoidable accidents with better infrastructure. And I think that may be one for the emergency docs, for example, that they would see a lot of these accidents come in that could be avoided with better infrastructure. So I think it's not to be ignored, and definitely something that would be on the minds of physicians moving forward, that healthier communities mean healthier people, and that's just better for everybody.
Thanks, Dan. And indeed, there is also the issue of whether we even should call them accidents, because in some cases these are by design. And there is an excellent book by Jesse Singer which talks about, which I think is called There Are No Accidents, because there is this idea of, we are designing. And in fact, I think one of your well, certainly more than one participant actually brought that up, didn't they? That it becomes that chicken and egg. Do we promote inadequate infrastructure when actually that's putting people into very difficult decisions? I can see another question coming in from David, but while we wait for that to come through, I also wanted to just ask you, Halifax has a new mayor who is an urban planner, Andy Fillmore, and what would you say to Andy if you had the opportunity to share your results with him, this kind of elevator pitch idea?
Yeah, of course. Thank you. I think for Andy, for example, I would just emphasize that the findings from this report are completely from people in the community. All these recommendations and concerns come from people who move within this community all the time. And I would say that from the urban planning point of view, that making active transportation better, and I think speaking to that point of putting in actual proper good infrastructure and not just doing it because you have to, would be important for making the community healthier, safer, better for all. I think now's the time for sure.
Thank you. And just actually, David has put in a comment that although a large UK study showed that all risk mortality was greatly reduced for bike commuters, the health impact greatly outweighs the risk of injuries and crashes, and that's also a very important point. Okay, I thought there was another comment coming in. Yep, I think there might be another one coming in. Dan's already stole my other question. Oh, I see Megan had your hand up actually. Yeah, so Megan, do you want to ask a question?
I guess my question, so Margaret, what I wanted you to speak on sort of from your mind is, I think what I heard in the interview was a lot of resonated with a lot of things we hear in community about what people think the holdbacks or barriers are for moving active transportation and getting action. I guess a question I want to ask, if you can just really speak directly to, did the people you spoke with tell you that this report or a report like this could help them in some way that a gap was missed? I guess I'm looking for, because cities are still going to fund these reports. They think they're important to do. They're going to develop indicators. It's going to happen. So I'm wondering if they gave you any insights as to this report would have been great if only they XXXX. Did you get any of that kind of flavor?
Yeah, thank you. I think that's a good point, because we definitely talked about the report throughout the interviews. And I think more not from the side of what the report could have done, but what should be done instead of the report. So a lot of the comments were about, this is great, but we already know this, I think was people's perspective for the most part. And that making the changes that they're recommending in the report were more important to them than just making the report, if that's coming across.
Okay, thanks for that. I feel like that should, if that's the flavor, I might have missed it, just headlining that actual flavor to be because I do think that, you'll see this whole effort bubble up again. And I heard you say it's expensive, it's an investment, but I think if there's quotes in there that really pull that out, that might be part of the story to tell. On to Mark. Margaret, thank you so much.
Thanks. Great discussion so far. And so I'll just read out Margaret Ann's question, which says, you may be answering this question, but I'm wondering where the pressure points might be with the city councillors, or is it with city staff? And I work with seniors who are even more resistant. Not really a report question, but what's the pitch? Which also is a great knowledge mobilization question.
Yeah, thank you. I'm also a Margaret Ann. Thank you for your question. I think where the pressure point is, I think where in a situation like this is where you're going to get in. So if you talk to these people and who will listen, and starting there and moving outwards, not always going to change the minds of everyone, of course, but I think going forward, promoting the idea of active transportation, better infrastructure, all that I talked about today, finding someone who agrees with your pitch, and then hopefully expanding to the rest.
Okay, thank you. Yeah, and I think also just one of the other things that we didn't have time to cover today is the fact that often you were speaking to people who weren't on the original working group, and so even simple things like good handover when people move jobs, because people do, move into different roles, and actually socializing and institutionalizing some of these things, I think is another key aspect of what you found when you were doing your interviews. And Becca has mentioned seniors. I would say a great question to ask seniors is, how long until your driver's license isn't valid anymore? Or what if you're unable to drive anymore, which is a great question. And yes, the Anna Zavatis book, When Driving is Not an Option, is a great book to reference. Yeah, thanks. It's a great point. So, Margaret, as a future physician, another question to think about. Okay, any other comments? So I see David is typing in a question again.
Maybe I can hurry it up by speaking.
Yeah, speaking, yeah.
The recent StatsCan report reported that Halifax had the second highest commuting AT rate in Canada, second only to Victoria. And I'm just wondering, in terms of, can you picture a way where positive information like that can be used to propagate more of the information that we need to actually make progress?
Yeah, thank you. I think obviously all positive that comes out is a good thing. I think promoting, saying, showing that we are using AT, let's make it better in some areas, and just, again, speaking to those connectivity or better infrastructure